Fundamentals Chapter 4. Disorders and Diseases of the Skin. Learning Objectives. After completing this chapter, you will be able to explain why knowledge of diseases and disorders is valuable for an esthetician. Describe how an esthetician and a dermatologist can work collaboratively. Identify the differences between primary, secondary, and tertiary skin lesions. Recognize skin changes that could indicate a type of skin cancer. Describe the types of acne. Describe the symptoms of polycystic ovarian syndrome, COS. List common vascular conditions or disorders. Identify pigment disorders. Describe the different types of dermatitis. Identify the types of hypertrophies. Define 9 contagious skin and nail diseases. Identify 2 mental health conditions that may manifest as skin conditions. Recognize common skin conditions related to skin diseases and disorders. Explain 5 sudoriferous gland disorders. Explain why knowledge of diseases and disorders is valuable for an esthetician. Skin disorders and diseases are fascinating and complex subjects. Estheticians must be knowledgeable about skin disorders and diseases. As an esthetician, it is not within your scope of practice to diagnose skin diseases, but being savvy enough to recognize common medical conditions can help you work with clients more effectively and safely. Estheticians can provide client education and help clients with many of their skin concerns. Individuals that have skin problems can be affected emotionally by dealing with such a visible problem. Clients are in a vulnerable position when they bare their skin to you. Sensitivities about visible imperfections can have a lifetime effect on self-esteem. Even in the classroom, permitting our skin to be closely examined by others can be uncomfortable. Use positive words of encouragement and be mindful of how you discuss skin problems tactfully. Never work on any skin condition you do not recognize. When in doubt, stop the service. Let clients know if you do not recognize a condition or lesion, and they will appreciate your honesty and caution. Posting a photo of your client's skin on social media and asking for advice is not the way to get the right answers on how to treat your client's skin. Estheticians should study and have a thorough understanding of disorders and diseases of the skin because recognizing a potentially contagious skin disorder can stop the spread of infection. You will help individuals that have skin problems and have been affected emotionally by dealing with such a visible problem. Learning when to stop a service and refer a client to a medical professional may save their life. Describe how an esthetician and a dermatologist can work collaboratively. Dermatology is the branch of medical science that studies and treats the skin and its disorders and diseases. A dermatologist is a physician who treats these disorders and diseases. Recognizing skin disorders and diseases is important for the protection of both the technician and the client. Estheticians may not perform services on clients who have contagious or infectious diseases. Dermatologists, physicians, and nurse practitioners are qualified to diagnose skin problems. Estheticians may not diagnose disorders and diseases of the skin. It is outside of their scope of practice. However, once diagnosed, estheticians can help clients with many common disorders and conditions such as rosacea, acne, and hyperpigmentation. Caution and strict infection control practices are imperative when working with skin disorders. Knowledge of skin conditions that contraindicate, prohibit, a treatment is also necessary. Some lesions fit into more than one category and have more than one name or definition. Skin disorders are not easy to categorize, as they can be as diverse as the individuals dealing with the conditions and symptoms. Estheticians can work as members of a dermatology team to provide skincare treatments that will help to alleviate many of the symptoms of diagnosed diseases and disorders. Figure 4.1. Caution. Do not attempt to diagnose or treat medical conditions. Estheticians are not licensed to diagnose skin disorders or diseases. Refer clients to a medical professional if you think they have a disorder or disease that needs medical attention. Check in. What is the medical study of the skin called? Why can't an esthetician diagnose disorders or diseases? Identify the differences between primary, secondary, and tertiary skin lesions. Lesions are structural changes in the tissues caused by damage or injury. Any mark, wound, or abnormality is described as a lesion. The three types of lesions are primary, secondary, and tertiary. Some references call tertiary, or third type of lesions, vascular lesions. Vascular lesions involve the blood or circulatory system. Activity. Research local dermatology offices. Check out the websites of local dermatology offices. Record how many dermatology offices include estheticians as part of their staff. Write down 3 reasons that a dermatology office should have estheticians on their staff and present to the class. Primary lesions. Primary lesions are lesions in the initial stages of development or change. Primary lesions are characterized by flat, non-palpable changes in skin color or by elevations formed by fluid in a cavity, such as vesicles or pustules. Refer to Table 4:1 for descriptions for primary lesions of the skin and examples of each. Primary lesions. Primary lesions, bulla. Description: large blister containing a watery fluid, similar to a vesicle. Requires medical referral. Examples: contact dermatitis, large second-degree burns, bulbous impetigo, pemphigus. Primary lesions, cyst and tubercle. Description: closed, abnormally developed sac that contains pus, semi-fluid, or morbid matter above or below the skin. A cyst can be drained of fluid and a tubercle cannot. Requires medical referral. Examples: cyst, severe acne, tubercle, lipoma, erythema nodosum. Primary lesions, macule. Description: flat spot or discoloration on the skin. Example: freckle or age spot. Primary lesions, nodule. Description: a solid bump larger than 0.4 inches, 1 centimeter that can be easily felt. Requires medical referral. Example: swollen lymph nodes, rheumatoid nodules. Primary lesions, papule. Description: a small elevation on the skin that contains no fluid, but may develop pus. Example: acne, warts, elevated nevi. Primary lesion, tumor. Description: abnormal mass varying in size, shape, and color. Any type of abnormal mass, not always cancer. Requires medical referral. Example: cancer. Primary lesion, vesicle. Description: small blister or sac containing clear fluid, lying within or just beneath the epidermis. Requires medical referral if cause is unknown or untreatable with over-the-counter products. Example: poison ivy, poison oak. Primary lesion, wheal. Description: Margot. Description: an itchy, swollen lesion that can be caused by a blow, scratch, bite of an insect, urticaria, skin allergy, or the sting of a nettle. Typically resolves on its own, but referral to a physician should be considered when the condition lasts more than 3 days. Example: hives, mosquito bites. Secondary lesions. Secondary skin lesions are characterized by piles of material on the skin surface, such as a crust or scab, or by depressions in the skin surface, such as an ulcer. These may require medical referral. Refer to Table 4:2 for examples and definitions of secondary skin lesions. Secondary lesion, crust. Description: dead cells that form over a wound or blemish while healing, accumulation of sebum and pus, sometimes mixed with epidermal cells. Examples: scab, sore. Secondary lesion, excoriation. Secondary lesion, skin sore or abrasion produced by scratching or scraping. Examples: nail cuticle damage from nail biting. Secondary lesion, fissure. Description: crack in the skin that penetrates the dermis. Example: severely cracked and or chapped hands, lips, or feet. Secondary lesion, keloid. Description: a thick scar resulting from excessive growth of fibrous tissue. Keloids will form along any type of scar for people susceptible to them. Secondary lesion, scale. Description: thin, dry, or oily plate of epidermal flakes. Example: excessive dandruff, psoriasis. Secondary lesion, scar or cicatrix. Description: slightly raised or depressed area of the skin that forms as a result of the healing process related to an injury or lesion. Example: postoperative repair. Secondary lesion, ulcer. Description: open lesion on the skin or mucous membrane of the body, accompanied by loss of skin depth and possibly weeping of fluids or pus. Requires medical referral, particularly in clients with underlying medical conditions such as diabetes. Example: chickenpox, herpes. Check-in. Name and define the primary lesions. Name and define the secondary lesions. Recognize skin changes that could indicate a type of skin cancer. Skin cancer risk increases with cumulative ultraviolet, UV, sun exposure and is found in 3 distinct forms that vary in severity. Each form is named for the type of cells that are affected. Skin cancer is caused by damage to DNA. Skin cancer form when cells begin to divide rapidly and unevenly. See the skin cancer and sun exposure infographic for some facts on skin cancer. If detected early, these abnormal growths can be removed. If not taken care of, they can be deadly. Using sensitivity and concern, suggest that the client seek medical advice without diagnosing or speculating about the disorder. For example, you could say, "I'm concerned about this area on your forehead. Before I do any treatment on it, I need you to see your healthcare provider for an evaluation. I'll perform your service today and avoid this area." Clients will appreciate your concern and know that you have their best interests at heart. Annual medical skin checks are recommended for everyone to look for changes in the skin. Did you know? Benign means not harmful, malignant means cancerous. Carcinoma is a cancerous tissue. Actinic keratosis. An actinic keratosis is a pink or flesh-colored precancerous lesion that feels sharp or rough and is a result of sun damage. It should be checked by a dermatologist. Types of skin cancer. There are 3 main types of skin cancer. Refer to Table 4(3) for descriptions of each. Types of skin cancer. Moles, normal mole. Description: small brownish spot on the skin ranging in color from pale tan to brown or bluish black. Note, this is not a type of skin cancer. Moles, basal cell carcinoma. Description: most common and least severe type of skin cancer, which often appears as light, pearly nodules. Characteristics include sores, reddish patches, or a smooth growth with an elevated border. Moles, squamous cell carcinoma. Description: more serious than basal cell carcinoma, characterized by scaly, red or pink papules or nodules, also appear as open sores or crusty areas, can grow and spread in the body. Moles, malignant melanoma. Description: most serious form of skin cancer as it can spread quickly, metastasize. Black or dark patches on the skin are usually uneven in texture, jagged, or raised. Melanomas may have surface crust or bleed. Malignant melanoma is the least common, but is 100% fatal if left untreated. Early detection and treatment can result in a 94% 5-year survival rate, but that drops drastically, 62%, once it reaches local lymph nodes. Infrequent, intense UV exposure may increase the risk for melanoma more than chronic continuous exposure does. People with light skin and a tendency to burn with sun exposure are more susceptible to skin cancer. Oncology aesthetics. A medical niche has emerged for the esthetician certified in oncology aesthetics. As referenced in Chapter 1, oncology is the medical study of cancer, its causes and treatments. Treating skin that has been exposed to radiation and chemotherapy requires a depth of knowledge beyond basic aesthetics. The skin can be much more fragile and reactive. Additionally, you don't want to provide any treatment or skin care products that could be contraindicated with their cancer treatment. Clients with cancer still need the healing benefits of touch and can additionally benefit from skin care treatments that are soothing and calming. ABCDEs of melanoma detection. The American Cancer Society recommends using the ABCDE skin cancer checklist to help make potential skin cancer easier to recognize. When checking existing moles, look for changes in any of the following. Figure 4.2. A. Asymmetry, the two sides of the lesion are not identical. B. Border, the border is irregular on these lesions. C. Color, melanomas are usually dark and have more than one color or colors that fade into one another. D. Diameter, the lesion in a melanoma is usually at least the size of a pencil eraser. E. Evolving, melanoma as a lesion often changes appearance. Changes to any of these characteristics should be examined by a medical professional. For more information, contact the American Cancer Society at www.cancer.org or 800-ACS-2345. Did you know? Skinny on Skin is one program from the Impact Melanoma organization focused on educating beauty professionals to detect early signs of cancer. It is available free of charge. For more information, contact www.impactmelanoma.org. As estheticians, we may see our clients much more regularly than a client will see their medical provider. We can be key in noting a skin change and referring the client to a dermatologist for diagnosis and treatment. Check in. Describe the differences between the three types of skin cancer. Explain the checklist system used to identify skin cancers. Describe the types of acne. Acne is an inflammatory skin disorder of the sebaceous glands, medically known as acne simplex or acne vulgaris. It is characterized by excess sebum production. This excess oil and dead skin cells can plug pores, creating comedones, papules and pustules, and cysts. This causes a growth of Propionibacterium acne, P. acne, bacteria. Bacteria in the follicles are anaerobic, that is, the bacteria cannot live in the presence of oxygen. When follicles are blocked with sebum and dead skin buildup, oxygen cannot reach the bottom of the follicle. Sebum can irritate follicles and cause inflammation. As bacteria and inflammation grow, pressure is exerted on the follicle wall. If the wall ruptures, it becomes infected and debris spills out into the dermis. Redness and inflammation occur when that foreign debris created from the dead white blood cells is detected in the skin, and white blood cells move in to fight the infection. Papules are red, inflamed lesions caused by this process. Papules may become more infected and pus develops. These infected papules become pustules. Pustules are filled with fluid from the dead white blood cells that fought the infection. Cysts are nodules made up of deep pockets of infection. Skin forms hardened tissue around the infection to stop the spread of bacteria, which can lead to both depressed and raised scars from damage to the dermal tissue. Because it is in the dermis, this variety of acne, called cystic acne, should be treated by a medical professional. Causes of clogged follicles. Acne is something your clients may have to deal with throughout their lives in various stages. It is important for you to understand the causes of acne and treatments to best serve your client. Your consultation and assessment will be important as you develop a treatment plan that will take the causes of acne into consideration. Knowledge of the anatomy of the pilosebaceous unit gives you a deeper understanding of how acne behaves. Pilosebaceous unit is the term for the entire follicle that includes the hair shaft, sebaceous gland, and sebaceous duct or canal to the surface. The hairless follicle, with attached sebaceous glands, is the main follicle involved in acne. Clogged follicles are caused by many factors, including excess oil, retention hyperkeratosis, and sebaceous filaments. Another reason follicles get clogged is that the opening, or ostium, of the follicle may be too small to let impactions out. Notable sebaceous gland conditions and disorders are discussed in the following sections. Types of clogged follicles. The types of clogged follicles include the following. Comedo. A comedo is a non-inflamed buildup of cells, sebum, and other debris inside follicles, figure 4.3. An open comedo is a blackhead open at the surface and exposed to air. When the follicle is filled with excess oil, a blackhead forms. It is dark because it is exposed to oxygen and oxidation occurs. A closed comedo forms when the openings of the follicles are blocked with debris and white cells. It is also referred to as a whitehead but should not be confused with the more hardened white type of papules called milia. Sebaceous filaments. Sebaceous filaments, similar to open comedones, are mainly small, solidified impactions of oil without the cell matter. These filaments also block the follicle and can cause an acne breakout. They are often found on the nose. Milia. Milia are small epidermal cysts that appear as firm white papules. Milia are whitish, pearl-like masses of sebum and dead cells under the skin with no visible opening, and are often mistakenly called whiteheads. Whiteheads look similar but are soft. Hardened and closed over, milia are more common in dry skin types and may form after skin trauma, such as a laser resurfacing or chronic exposure to UV radiation. Newborns can sometimes get milia at birth or shortly thereafter. They resemble small sesame seeds and are almost always perfectly round. They are usually found around the eyes, cheeks, and forehead. Milia can also be caused by blocked follicular openings from oil-based moisturizers. Treatment for milia. Depending on the state, milia can be treated in the salon or spa. Increasing exfoliation and using a retinol product can thin the stratum corneum and gradually eradicate milia. Another treatment option is using an extraction tool to make a tiny opening in the epidermis to expose the milia. With gentle pressure, they usually can be removed from the opening. If they do not pop out, it is best to leave them alone and they will often decompress with regular cleansing, exfoliation, and retinol application. Retention hyperkeratosis. Retention hyperkeratosis is a hereditary factor in which dead skin cells build up because they do not shed from the follicles as they do on normal skin. Additionally, excessive sebum production can overtax the sebaceous follicles and cause further cell buildup. Sebum mixed with cells in the follicle become comedones, plugs in the follicles. Consequently, open and closed comedones are formed. While not inflamed, these comedones are the beginning of acne problems if they are not treated with proper skin care to alleviate the impaction. Sebaceous hyperplasia. Sebaceous hyperplasia involves benign lesions frequently seen in oilier areas of the face. They are often white, yellow, or flesh-colored. Sebaceous hyperplasia is described as donut-shaped with an indentation in the center. Sebaceous material may be found in the center. As cell turnover rate slows with age and androgen levels decline, this causes abnormal cell buildup with very little oil that crowds and enlarges sebaceous glands. Do not mistake these overgrowths of the sebaceous gland for comedones or milia, which may look similar at first. These harmless lesions cannot be removed by extraction. Cryotherapy, surgery, or laser excision are recommended treatment options. Seborrhea. Seborrhea is a severe oiliness of the skin, an abnormal secretion from the sebaceous glands. When it is in the scalp, it is called dandruff or seborrheic dermatitis, but it can occur around the eyebrows, behind the ears, and around the nose or other areas of the face. It is not acne, although the inflammation in the skin from seborrhea can be misidentified as acne. Later in this chapter you will learn more about seborrheic dermatitis. Grades of acne. Acne is graded on a scale of 1 to 4, Table 4, 4. Grade 1 acne is mild and usually treated with over-the-counter skin care, whereas Grade 4 acne has progressed to consistent breakouts and deep cysts that require medical intervention. Grades of acne. Grade I, minor breakouts, mostly open comedones, some closed comedones, and a few papules. Grade 2, many closed comedones, more open comedones, and occasional papules and pustules. Grade 3, red and inflamed, many comedones, papules, and pustules. Grade 4, cystic acne, cysts with comedones, papules, pustules, and inflammation. Scar formation from tissue damage is common. Acne triggers. Genetic, hormonal, environmental, lifestyle, certain products, and dietary influences affect acneic breakouts. During the consultation, you can ask questions about each of these subjects and learn more to develop a treatment plan to help your client. Educating your client about each of the following factors and getting your client's cooperation in making changes can improve acneic breakouts. Genetics. You need to know if your client's parents had acne during puberty or any other time and whether other family members have acne. If acne is a familial disorder, your client's acne will be influenced by that DNA programming. Treatment for genetic influences. If acne has a genetic component, your client needs to understand that you can help get the breakouts under control, but curing the acne will not be possible. With a comprehensive approach that addresses the skin holistically, your clients will experience the best improvements in their skin. Hormones. The androgen fluctuations during puberty, monthly menstrual cycle hormone surges, pregnancy, and perimenopause contribute to oil production changes that can bring on comedones, papules, and pustules that usually evidence themselves periodically. Premenstrual water retention can cause slight swelling, enough to influence the epidermis and block pilosebaceous units. During the consultation, you may have to dig deeper to get a better understanding of hormonally induced acne. You may suggest your client see their medical professional for a change in birth control prescriptions, if the acne developed when the client started on a pill or an intrauterine device, IUD, birth control or following a hormonal injection. If the acne is a result of hormonal changes during pregnancy and perimenopause, you can let your client know that its severity will change as the pregnancy progresses and hormonal fluctuations shift. Your client may be able to influence the breakouts that occur from menstrual cycle hormone surges by limiting sodium intake and increasing water intake. Treatment for hormonal influences. Treatment options for hormonally induced acne include additional exfoliation to keep the stratum corneum thin so oil can escape to the surface more easily. Commonly, this includes chemical peels, enzyme peels, and microdermabrasion options. Home care products can include an antibacterial cleanser, salicylic acid-based products that are lipophilic, and water-based moisturizers. Environment. Working in an environment with poor air quality, pollutants, or comedogenic exposure can increase the inflammatory response of the sebaceous glands. Dramatic climate changes, including changing seasons, humidity, and temperature, influence oil production. Understanding your client's work environment is another aspect of the puzzle you will be solving when helping your clients with acne. Does your client work around oils, chemicals, grease, or ink? Does your client work in an area with poor air quality? Is your client exposed to high levels of carbon dioxide from car exhaust in a city environment? Treatment for environmental influences. Encouraging your client to cleanse their face at the end of the workday to remove residual pollution, oil, grime, and other pore-clogging factors can improve skin quality. Occlusive products may be too heavy and trap bacteria. Treatments that exfoliate as well as oxygenate the skin can help. The P. acne bacteria cannot live in an environment rich with oxygen. Lifestyle. Stress can stimulate the adrenal gland to produce more hormones, which leads to more oil production. Did your client recently start a new job or lose employment? Has your client had a romantic breakup or recently gotten engaged or married? Has there been a death in the family or loss of a close friend? A move to a new home or new town? What about a challenging home situation? A long commute can contribute to stress. Adrenal glands that are constantly excreting adrenaline to keep up with the pace of an overly active lifestyle can create a hormonal imbalance that can affect the skin. Pressure or friction from cell phones along with wearing hats or scarves and any other device or object that routinely touches the face can transfer bacteria to the face and induce a breakout. Fragrances from dryer sheets, laundry detergents, or shampoos can cause a sensitivity and a breakout. Treatment for lifestyle influences. Suggesting lifestyle changes to your client can help them find the triggers that stimulate an acne flare-up. Sometimes a simple fix such as more frequent changing of a pillowcase can make a difference. Cosmetics and skincare products. Certain ingredients in products can aggravate acne. Fatty ingredients such as waxes and some oils can clog or irritate follicles. These comedogenic ingredients can block follicles, which causes cell buildup, resulting in comedones. Products rich in emollients and occlusive products are too heavy for skin prone to breakouts. Moisturizers and sunscreens should be lighter formulas such as oil and water, O/W, emulsions, not water in oil, W/O, emulsions. Many makeup products are comedogenic, especially foundations and powders that are made with solids and fatty ingredients. Makeup products become contaminated with unhygienic application techniques. Products for hair and skin can trigger or irritate acne. Products are discussed thoroughly in Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection. Treatment for product irritation. Educating your client on routine cleaning of makeup brushes and the use of disposable sponges to apply foundation can help with breakouts. Diet. An increasing number of studies are linking food allergies or sensitivities to acne. Foods with a higher glucose index, processed foods, foods with heavy iodide content, and dairy are thought to be contributors to acne, although the relationship is not fully understood. Treatment for dietary influences. You are not a nutritionist or dietitian, but you can encourage your clients to eat a healthy diet and drink plenty of water. You can suggest clients see a specialist for dietary changes that may improve the health of their skin. Medicated treatment options for acne. Regular skincare sessions, with exfoliation and incorporating modalities like high-frequency, microdermabrasion, and chemical peels, can help keep the stratum corneum thin, keep oil production under control, add hydration, and oxygenate the skin to eliminate bacteria. Electrical devices and chemical exfoliation are covered in Chapter 10, Facial Devices and Technology, and Chapter 13, Advanced Topics and Treatments. However, treatment options for acne can also include a collaborative approach with medical professionals and the esthetician. They are varied and include the use of topical antibacterial agents to eliminate the P. acne bacteria, Table 4, 5. Antibiotics can be used, both orally and topically. The potential for developing antibiotic resistance is the reason why medical professionals are reducing the use of these drugs to treat chronic acne. If the client acquires a serious infection later in life, antibiotics may not work to fight that infection because of the antibiotic resistance that developed during the long-term use to improve the acne. Considerations for medicated acne treatment. You can't cure acne, but you can help control the breakouts. The passage of time is often the cure, as a teen moves out of puberty, perimenopause transitions to menopause, or stressful lifestyle habits change. You can help your clients have more confidence in social situations with clearer skin. More information on acne medications available to clients includes the following. Home care products should include ingredients with benzoyl peroxide and vitamin A products like tretinoin, retinoids, and adapalene. Moisturizers and serums that are low on the comedogenic scale are best. Skincare ingredients are discussed in the chapter on Chapter 6 Skincare Products, Chemistry, Ingredients, and Selection. Benzoyl peroxide products are often combined with topical antibiotics. This combination helps reduce the chances of developing antibiotic resistance. Topical antibiotics alone aren't typically prescribed. These products should be applied in the morning because they can discolor pillowcases. Vitamin A products should be applied in the evening because they are photosensitizing. Clients should apply a very small pea-sized amount beginning twice a week, increase the application to 3 times a week, then use the product every other day and finally every day as a tolerance to the product is developed. These products work by thinning the stratum corneum, increasing cell turnover, and preventing hair follicles from becoming clogged with sebum and dead skin cells. Salicylic acid and azelaic acid are both antibacterial. Salicylic acid is lipophilic, so it works to digest sebum. Oral medications to help with acne in addition to antibiotics are often drugs to counter the effects of androgen hormones. An example is spironolactone. Birth control pills are another prescription medication that can influence acne, reducing breakouts from hormonally induced acne. Check in. Explain the differences between an open and a closed comedone. Describe the 4 grades of acne. Give examples of 3 different kinds of medications used to treat acne. Describe the symptoms of polycystic ovarian syndrome, COS. Polycystic ovarian syndrome, COS, often shortened and pronounced PCOS, is a hormonal condition that affects 1 in 20 women in their childbearing years, according to the U.S. Department of Health and Human Services, Figure 4.4. It is believed to have a genetic component. Symptoms include increased androgen production that causes the development of cysts on the ovaries. The cysts create irregular menstrual cycles and difficulty with fertility. Clients with COS are insulin resistant and have challenges with weight loss. Sleep apnea is also a symptom. The esthetician will work with the client who has COS because COS symptoms include acne, thinning hair in a male hair growth pattern of baldness, which is sparse hair density at the front and top of the scalp. It also causes abnormal hair growth on the face, arms, thighs, neck, and breasts. Clients with COS may feel self-conscious about their body image. They may feel they have lost control on many levels. COS is not a condition that is cured, but symptoms can be managed. Birth control pills can help regulate the sex hormones, and androgen-blocking medication can help control hair growth and acne issues. Performing hair removal treatments with waxing or laser services can help keep unwanted hair under better control. Skin care treatments using ingredients that influence the formation of comedones keep the stratum corneum thin. Treatments that influence acne breakouts, like microdermabrasion, high frequency, and an ultrasonic skin scrubber, are helpful. Additionally, providing emotional support can help your client. Check in. Describe how an esthetician could help a client with COS. List common vascular conditions or disorders. Vascular conditions and disorders can be hard for a client to deal with, so it is important to understand the types to better help your clients. As mentioned earlier, these types of vascular lesions may be considered tertiary lesions. Rosacea. Rosacea is an inflammatory and vascular disorder with multiple causes that are not completely understood, Figure 4.5. It is a progressive disorder that starts with flushing and increasing bouts of redness. Visible vessels and skin sensitivity are symptoms. The symptoms can progress to pustular-type breakouts that can be confused with acne. Rosacea can affect the eyes as well, causing chronic bloodshot eyes, some clear to yellowish discharge, and irritation. In advanced cases, the rosacea can cause skin thickening, particularly around the nose. This symptom is called rhinophema. Rosacea can be challenging to treat because of its unclear origins. Heredity, bacteria, the Demodex mite, and fungus are possible theories. Certain factors are known to aggravate the condition. Vasodilation, vascular dilation, of the blood vessels makes rosacea worse. Spicy foods, alcohol, caffeine, temperature extremes, heat, sun, and stress aggravate rosacea symptoms. Rosacea treatments. Like acne, estheticians can treat the symptoms of rosacea, but cannot cure the disorder. Symptom management is the goal when working with a rosacea client. Rosacea treatments should include collaboration with medical professionals. Antifungal prescription skincare products may help. Skin calming ingredients and treatments will help decrease inflammation. Provide soothing facials with gentle massage and light exfoliation. Limit the use of steam. Adding high frequency to oxygenate the skin can help. Some advanced aesthetic procedures with lasers, intense pulsed light, IPL, and radiofrequency devices can be effective. Telangiectasia. Telangiectasia is visible capillaries, 0.5 to 1 mm in diameter, that are commonly found on the face, particularly around the nose, cheeks, and chin, Figure 4.6. They can appear due to an injury, heredity, rosacea, hormonal changes, or exposure to extreme cold or heat. A matting of tiny telangiectasia creates a ruddy complexion, called couperose skin. Telangiectasia is a cosmetic irregularity and is not a medical condition. Varicose veins. Varicose veins are visible vascularity that are abnormally dilated and twisted veins that can occur anywhere in the body. They are often on the legs. Pregnancy, extended periods of time standing and sitting, and genetics are contributing factors. Sometimes treatments with sclerotherapy, an injection into the vein with a solution that causes the vein to collapse, can cause smaller vessels to disappear, figure 4.7. Varicose veins are a condition that should be treated by a medical professional. Such treatment could include surgery for large twisted vessels. Check-in. Explain the progression of rosacea. List 4 rosacea triggers. Summarize how to treat rosacea. Identify pigment disorders. The genetic background of a person influences pigmentation disorders. Abnormal pigmentation, referred to as dyschromia, can be caused by various internal and external factors. Hyperpigmentation, overproduction of pigment, and hypopigmentation, lack of pigment, are the two types of pigmentation disorders. Sun exposure is the biggest external cause of pigmentation disorders and can make existing pigmentation disorders worse. Drugs may also cause skin pigmentation abnormalities. Hyperpigmentation is a frequent concern for clients and is discussed in subsequent chapters, figure 4.8. Hyperpigmentation. Hyperpigmentation appears in the following forms. Melasma. Melasma is a type of hormonal hyperpigmentation disorder that first appears during pregnancy or with the use of birth control pills. Melasma has an identifiable pattern of solid, fairly symmetrical hyperpigmentation, often on the forehead, cheeks, upper lip, and chin, figure 4.9. Sun exposure can exacerbate the pigmentation of melasma, so a person may have melasma and sun damage. Addressing the symptoms of melasma can be a challenge for an esthetician. The pigmentation can fade during times of low UV exposure. Hormones returning to normal levels after pregnancy will alleviate the pigmentation. The consistent use of melanocyte-inhibiting skincare products as well as sunscreen application is essential. A series of chemical peels can lighten the pigmentation. Some high-energy laser devices with nanosecond or picosecond technology and fractional radio frequency treatments can offer visible improvements. Melasma is a condition that requires management. There is no cure. Lentigo. Lentigo is a flat, pigmented area similar to a freckle, small, yellow-brown spots, figure 4.10. Lentigines are multiple pigmented lesions. Medical professionals identify lentigenes that result from sunlight exposure as actinic or solar lentigenes. Your client may call them age spots, as they are associated with aging skin. Ephelids. Ephelids, also known as freckles, are tiny round or oval pigmented areas of skin on areas exposed to the sun, figure 4.11. Also referred to as macules, they are small flat colored spots on the skin. Nevus. Nevus, also known as birthmark, is a malformation of the skin from abnormal pigmentation or dilated capillaries that is present at birth or appears shortly after birth. A port wine stain is a vascular type of nevus. Figure 4.12 is an example of a pigmented nevus. Figure 4.12b is an example of a vascular nevus. Poikiloderma of civet. Poikiloderma of civet is a skin condition caused by actinic bronzing, chronic sun exposure, to the sides of the face and neck. The skin turns a reddish-brown hue with a distinct white patch under the chin. Poikiloderma is benign, meaning it is not cancerous. Treatment can be a combination of melanocyte-inhibiting skincare, chemical peels, advanced treatments with lasers and IPLs, consistent sunscreen protection, and avoiding irritants, such as heavy fragrances, on the skin. Post-inflammatory hyperpigmentation. Post-inflammatory hyperpigmentation is darkened pigmentation due to an injury to the skin or the residual healing after an acne lesion has resolved. Figure 4.13. It is often deep red, purple, or brown in appearance. Tan. Tan results from exposure to the sun. Tanning is a change in pigmentation due to melanin production as a defense against UV radiation that damages the skin. A tan is basically visible skin and cell damage. Hypopigmentation. Hypopigmentation occurs in various forms. It is seen less commonly than hyperpigmentation disorders. Leukoderma. Leukoderma is a loss of pigmentation leading to light, abnormal patches of depigmented skin. It is a congenital disorder acquired due to immunological and post-inflammatory causes. Vitiligo and albinism are leukodermas. Albinism. Albinism is a rare genetic condition characterized by a lack of melanin pigment in the body, including the skin, hair, and eyes. The person is at risk for skin cancer, is sensitive to light, and ages early without normal melanin protection. The technical term for albinism is congenital leukoderma or congenital hypopigmentation. Vitiligo. Vitiligo is a pigmentation disease characterized by white irregular patches of skin that are totally lacking pigment. Figure 4.14. The condition can worsen with time and sunlight. The disease can occur at any age and is believed to be an autoimmune disorder causing an absence of melanocytes. Tinea versicolor. Tinea versicolor, also called pityriasis versicolor, is a fungal condition that inhibits melanin production. It is not contagious because it is caused by yeast, a normal part of the human skin. It is characterized by white, brown, or salmon-colored flaky patches. Figure 4.15. Sun exposure can stimulate the growth of the fungus. This fungus can be treated with antifungal cream or other medication. Selenium sulfide shampoos can also treat the condition. High humidity and summer heat stimulate the condition. It usually fades in the cold winter season and recurs with warmer weather. To the layperson, tinea versicolor can be misinterpreted as vitiligo, so referral to a medical professional is important. Check-in. List 3 disorders characterized by hyperpigmentation. Describe tinea versicolor and its treatment. Describe the different types of dermatitis. Dermatitis is a generalized term to refer to an inflammatory condition of the skin. Various forms include lesions such as eczema, vesicles, or papules. Figure 4.16. Dermatitis has many forms, and symptoms of one form can be confused with symptoms of another form. Referral to a medical professional is recommended for appropriate diagnosis. Contact dermatitis. Occupational disorders from ingredients in cosmetics and chemical solutions can cause contact dermatitis, or dermatitis venenata. Contact with allergens and caustic chemicals can also cause skin sensitivity or disorders. Allergies and skin eruptions are common. Wearing gloves or protective skin creams while working with chemicals or irritating substances can help prevent contact dermatitis. Allergic contact dermatitis. Allergic contact dermatitis is caused by exposure to and direct skin contact with an allergen. Normally, the immune system protects us from pathogens and disease, but with an allergic reaction, the immune system causes the problem by trying to do its job too well. An allergic reaction occurs when our immune system mistakes a benign substance for a toxic one and initiates a major defense against it. Caution. The following reactions from chemicals are commonly seen in the salon. On the practitioner's fingers, palms, or on the back of the hand. On the practitioner's face, especially the cheeks. On the client's scalp, hairline, forehead, or neckline. If you examine the area where the problem occurs, you can usually determine the cause. For example, technicians may react to chemicals in disinfectants or strong skincare products. This is both prolonged and repeated contact. Sensitization is an increased or exaggerated sensitivity to products. Wear gloves to avoid potential reactions. eyes and lungs can also be affected by exposure to strong chemicals or other ingredients. Initial exposure to an allergen does not always cause an allergic reaction. The development of hypersensitivity is the result of repeated exposure to an allergen over time. This process is called sensitization, and it may take months or years depending on the allergen and the intensity of exposure. Also remember that different people develop allergies to different allergens. Individual predisposition to allergies may be inherited. Sensitivity seems to run in families. Contact dermatitis and red, itchy skin can be caused by an allergic reaction or contact with an irritant, such as these common allergens. Makeup, skincare products, detergents, dyes, fabrics, jewelry, plants, red dyes in products, nickel in jewelry. Atopic dermatitis. Atopic dermatitis is a chronic, relapsing form of dermatitis. Atopic means excess inflammation from allergies. Irritants and allergens trigger reactions that include dry, cracked skin, figure 4:17. The redness, itching, and dehydration of the dermatitis make the condition worse. Use of humidifiers and lotion can help keep the skin more hydrated. Topical corticosteroids can relieve the symptoms. Eczema. Eczema is an inflammatory, painful, itching disease of the skin, is acute or chronic in nature, and has dry or moist lesions, figure 4:18. A client with eczema should be referred to a physician. Avoid contact and skin care treatments if a client has eczema. Irritant contact dermatitis. Everyone who comes in contact with an irritant is affected by irritant reactions, although the degree of irritation will vary depending on the individual. In acute cases, symptoms are noticed immediately or within just a few hours. Chronic cases may be delayed reactions that take weeks, months, or years to develop. Symptoms range from redness, swelling, scaling, and itching to serious, painful chemical burns, figure 4:19. Irritating substances temporarily damage the epidermis. Caustic substances are examples of irritants. When the skin is damaged by irritating substances, the immune system springs into action. It floods the tissue with water, trying to dilute the irritant. Therefore, swelling occurs. The immune system also releases histamines, which enlarge the vessels around the injury. Blood can then rush to the area more quickly and help remove the irritating substance. The extra blood under the skin is easily visible. The entire area becomes red and warm, and it may throb. Histamines cause the itchy feeling that often accompanies contact dermatitis. After everything calms down, the swelling will go away. The surrounding skin is often left damaged, scaly, cracked, and dry. Fortunately, irritations are not permanent. If you avoid repeated and/or prolonged contact with the irritating substance, the skin will usually quickly repair itself. However, continued or repeated exposure may lead to chronic allergic reactions and skin damage. You may notice irritant contact dermatitis when a teen client comes in for an acne consultation. You may note a breakout on the client's chin and learn they play football. You must rule out the possibility of irritant contact dermatitis from the football helmet chin strap before beginning a treatment plan for the acne. Perioral dermatitis. Perioral dermatitis is an acne-like condition around the mouth consisting mainly of small clusters of papules. It may be caused by toothpaste or products used on the face, figure 4:20. It is not contagious. Antibiotics can help treat the condition. Seborrheic dermatitis. Seborrheic dermatitis is a form of eczema characterized by inflammation, dry or oily scaling or crusting, and/or itchiness, figure 4:21. The red, flaky skin often appears in the eyebrows, on the scalp and along the hairline, in the middle of the forehead, and along the sides of the nose. One cause is inflammation of the sebaceous glands. This condition is sometimes treated with cortisone creams. Severe cases should be referred to a dermatologist. Stasis dermatitis. Stasis dermatitis is caused by poor circulation in the lower legs that can create a chronic inflammatory state. The legs may sometimes have ulcerations, along with scaly skin, itching, and hyperpigmentation. The hyperpigmentation is caused by hemosiderin staining, a brown-reddish discoloration due to iron deposits in the blood leaking into the tissues, Figure 4.22. A client with this type of skin disorder needs a cardiovascular referral. Even when the circulatory issues are resolved, the hemosiderin staining can remain. Advanced aesthetic treatments with IPL can help improve the appearance. Did you know? Poison ivy is a common allergen. Although approximately 75% of the population is allergic to poison ivy, the remaining 25% will never have a reaction no matter how many times they are exposed. Individuals who are not predisposed never become sensitized and will not develop an allergic reaction. Check in. List the inflammations of the skin. Identify the types of hypertrophies. Hypertrophy is defined as an abnormal growth. Many are benign or harmless. However, some growths are premalignant or malignant and can be dangerous or cancerous. The term hypertrophic is used to describe thickening of a tissue. The opposite of hypertrophy is atrophy, which means wasting away or thinning. Keloids are an example of hypertrophies. Types of hypertrophies include the following. Hyperkeratosis, thickening of the skin caused by a mass of keratinocytes. Keratoma, an acquired thickened patch of epidermis. A callus caused by pressure or friction is a keratoma. If the thickening also grows inward, it becomes a corn. Keratosis, an abnormally thick buildup of skin cells. Keratosis pilaris, redness and bumpiness in the cheeks, upper arms, or thighs, caused by blocked follicles. It has the appearance of chicken skin, Figure 4.23. It is not well understood but is often genetic and disappears after the age of 30. Many young women feel self-conscious about this condition and will seek an esthetician's help. Topical chemical exfoliants that keep the follicles free of keratin, like alpha-hydroxyl acid, AHA, or beta-hydroxyl acid, BHA, products, along with light mechanical exfoliation, can help unblock follicles and alleviate the rough feeling. Care must be taken to prevent too aggressive an approach and disturb the acid-mantle balance, causing dermatitis or infection. Mole, a pigmented nevus, a brownish spot ranging in color from tan to bluish-black. Some are flat, resembling freckles, others are raised and darker. Most are benign, but changes in mole color or shape should be checked by a physician. Hairs in moles are common. The hair may be tweezed from a mole if the client desires. The belief that hair in moles should not be removed is an old wives' tale. Moles should be observed for changes with the American Cancer Society's ABCDEs of melanoma check. Psoriasis, an itchy skin disease characterized by red patches covered with white silver scales, caused by an overproliferation of skin cells that replicate too fast, Figure 4.24. Psoriasis is usually found in patches on the scalp, elbows, knees, chest, and lower back. If patches are irritated, bleeding can occur. Psoriasis is not contagious but can be spread by irritating the affected area. It is thought to be an autoimmune disorder and clients experience flare-ups that can be controlled with oral and topical medications. Light therapy is also thought to be helpful. Clients with psoriasis are often also diagnosed with cardiovascular disease. Figure 4.24. Skin tag, small outgrowth or extension of the skin that looks like a flap. They are benign and are common under the arms, on the neck, or breast area caused by friction, Figure 4.25. Check in. What are 4 hypertrophies of the skin? How is keratosis pilaris treated? Define 9 contagious skin and nail diseases. The term contagious disease is used interchangeably with the terms infectious or communicable disease. Do not perform services on anyone with a contagious disease because it can spread and infect others. Refer them to a medical professional. The following are contagious diseases. Conjunctivitis, also known as pink eye, inflammation of the mucous membrane, conjunctiva, around the eye due to chemical, bacterial, or viral causes, very contagious, figure 4.26. It can be treated with antibiotics. Herpes simplex virus 1, fever, blisters or cold sores, recurring viral infection, a vesicle or group of vesicles on a red, swollen base. The blisters usually appear on the lips or nostrils, figure 4.27. Herpes simplex virus 1 causes cold sores and lesions around the mouth. It is a contagious disease treated with antiviral medication to shorten the outbreak. Herpes simplex virus 2, genital herpes, never work on clients with active herpes lesions, figure 4.28. Peels, waxing, or other stimuli may cause a breakout, even if the condition is not currently active. The virus can be spread to other areas on the person that is infected or to other people. This is an example of why reviewing the client intake form is important. Herpes zoster, also known as shingles, a painful skin condition due to reactivation of the chickenpox virus, also known as the varicella zoster virus, VZV. Shingles is a viral infection of the sensory nerves characterized by groups of red blisters that form a rash that occurs in a ring or line, figure 4.29. The rash is typically confined to one side of the body. VZV can cause nerve and organ damage along with severe pain that can last for months or years. Treatment includes antiviral drugs to shorten the length of the outbreak. Impetigo, a bacterial infection of the skin that often occurs in children, characterized by clusters of small blisters or crusty lesions filled with bacteria, figure 4.30. It is extremely contagious. Oral and topical antibiotics are used in treatment. An untrained eye may misinterpret impetigo and assume herpes, acne, or dermatitis. Professional medical intervention is the correct course of action for your client. Onychomycosis, fungal infection that produces symptoms of thick, brittle, discolored nails, figure 4.31. The fungus lives off the keratin in the nails. Onychomycosis can be challenging to eradicate because fungus likes to grow in dark, moist places, and shoes can be the perfect environment. Clients with onychomycosis can feel embarrassed about the appearance of the nails and discouraged during a course of treatment because of slow nail growth. Estheticians could encounter this when doing body wraps or during hand and foot massages with a facial. If onychomycosis is discovered, the facial service can be continued, but the esthetician should not continue with the hand/foot massage. Tinea, fungal infections. Fungi feed on proteins, carbohydrates, and lipids in the skin. Tinea pedis, athlete's foot, is a fungal infection that can be treated with antifungal topical powders, sprays, or creams. Estheticians could encounter this type of infection when doing body wraps or during hand and foot massages with a facial. If you are reviewing a client intake form and see the word tinea, you will know that the client has a fungus and you should determine the location prior to treatment. Tinea corporis, also known as ringworm, caused by a fungus, is not a worm. It looks like a skin irritation that spreads into a circular infection that is red and scaly, figure 4.32. It can be dry or moist. It can be spread by direct contact as well as indirect contact with items that have touched the skin of the infected person. Pets can carry tinea corporis. It is important to use a fungicide to disinfect items that have come in contact with the client who has the infection, including clothing, blankets, and towels. It can be treated with either oral or topical antifungals. Verruca, also known as wart, a hypertrophy of the papillae and epidermis caused by a virus. They are not cancerous, but they are contagious. Verrucas are typically flesh-colored but can be brown or black. They can appear singly or in clusters, figure 4.33. Verrucas are not well understood. They can spontaneously disappear, but there are several treatment options, including cryotherapy, electric therapy, surgical excision, and chemical exfoliation. Chemical exfoliation involves the application of a strong salicylic acid at home that peels the wart off in layers. When treating a client with warts, it is imperative that you wear gloves to avoid spreading the virus to other locations on the client's body or inadvertently to another client. Caution. Do not work on clients if you have an open verruca, commonly called a wart, or any other contagious conditions on any area that would contact the client. Do not touch clients' warts or plantar warts on the feet because these are a contagious virus and you could inadvertently spread the virus. Check in. Name and define 9 contagious skin and/or nail disorders. Which contagious diseases contraindicate skin care treatments? Identify 2 mental health conditions that may manifest as skin conditions. Dermatillomania is a form of obsessive-compulsive disorder, OCD, in which the person picks at their skin to the point of injury, infection, or scarring. A person with dermatillomania finds the picking stress-relieving and not painful. It can often be socially isolating because severe dermatillomania can be disfiguring. Uninformed people may assume the person has a methamphetamine addiction. Treatment includes cognitive behavior therapy, hypnosis, and medication. Body dysmorphic disorder is a psychological disorder in which the client has a preoccupation with their appearance. They do not have a realistic picture of what they look like, figure 4:34. They tend to fixate on minor appearance imperfections and see them as disfiguring. They believe others are viewing them negatively because of their physical appearance. They may check the mirror frequently and need an abnormal amount of reassurance that their appearance is acceptable. They may be spa hoppers or have a history of many cosmetic surgeries or treatments to fix their perceived flaws. They are dissatisfied with the outcome after treatments. This client will be challenging to manage and will require medical intervention with cognitive behavioral therapy and medication. Focus on scientific research. When researching topics, keep an open mind and determine the reliability of the source providing the information. What is found to be true one year may change with new evidence and discoveries. This is true of many topics, including the skin and health sciences. It's important to dig deeper to verify and analyze what we are reading. Just because it's in print or on the internet does not make it true. Check in. Describe dermatillomania and how it is treated. Explain the behavior of a person with body dysmorphic disorder. Recognize common skin conditions related to skin diseases and disorders. The skin conditions in Table 4:6 are often symptoms of more than one skin disease or skin disorder. Several of them look very similar to another. If you encounter these conditions, you will need to make an assessment and judgment about treatments. Perhaps a condition is the result of an infection, or is it the appropriate clinical endpoint of an effective treatment? Having confidence in identifying these conditions will give you confidence when determining a treatment plan and also give your client confidence in your skills. Table 4:6. Check in. Describe edema, erythema, and pruritus. Explain 5 sudoriferous gland disorders. Disorders of the sudoriferous glands include the following. Anhidrosis, a deficiency in perspiration due to failure of the sweat glands, often results from a fever or skin disease. Anhidrosis requires medical treatment. Bromidrosis is foul-smelling perspiration, usually in the armpits or on the feet. Bromidrosis is caused by bacteria and yeast that break down the sweat on the surface of the skin. Hyperhidrosis, chronic excessive perspiration caused by heat, genetics, stress, or medications. An FDA-approved treatment for hyperhidrosis includes the use of microwave technology to destroy the underarm sudoriferous glands. One treatment is usually up to 80% effective. Neuromodulators, like Botox Cosmetic registered, are also used to inhibit the sudoriferous gland production. Diaphoresis, excessive perspiration due to an underlying medical condition. Menopause is an example. Miliaria rubra, also known as prickly heat, acute inflammatory disorder of the sweat glands, results in the eruption of red vesicles and burning, itching skin from excessive heat exposure, figure 4:35. Recognizing a potentially contagious skin disorder can stop the spread of infection. You can formulate a more specific treatment plan and use the appropriate products when you can identify common skin disorders, such as rosacea and acne. Understanding that some skin disorders are contraindications for treatments will help you avoid a negative outcome. The medical field is progressing and the treatment of skin disorders and diseases is becoming easier with advances in technology, ingredients, and medications. Although there are hundreds of disorders and diseases, the majority of the ones you may commonly encounter are discussed in this chapter, along with some that are unique. Knowledge of skin problems takes years of experience and study, but reference books and credible medical websites are helpful in identifying these disorders and diseases. Check in. Explain 5 sudoriferous gland disorders.